Good morning, friends. Welcome to our next learning session. Today I am going to speak on effects of smoking and tobacco on sexual functions. But before going into these details, you must understand the anatomy of the sexual functions. Look at this diagram which I am going to bring close to your screen. Concentrate on this diagram and then I will explain what this is showing you. Now if you look carefully, this T is marked for testes. Both sides you have testes. From on the top of testes, this structure is called epididymis, and from the epididymis a small tube runs like this up and goes right into the bladder, urinary bladder. Now from the urinary bladder, this is the prostate and this is the urethra through which you pass your urine, and it is a common tube for your semen as well as for urine, and then it out of the body. Now look at this is the B I have marked, it is the urinary bladder, this is the prostate, this is the testis, and this is vas deferens, the tube which carries sperms from the testis to the out for reproduction. See another diagram which I bring close to your screen, and look at this diagram carefully to understand the female anatomy. This structure is rounded structure, element size structure is called ovary. Both sides you have ovaries. These are supported by certain ligaments here, and the end of this there is a tube here going like this way, and from this side it is going like this here, and this is called fallopian tube or uterine tube. The ova is word ova we use for the plural, and ovum we use for single egg is called ovum. These eggs are produced in the ovary. These are under the control of certain hormones, which is purely medical part. I am not going to tell you about that, but from here the matured ovum enters the fallopian tube, or called uterine tube, and then through the uterine tube somewhere here it meets the sperms and gets fertilized. When fertilized, it moves further into the uterus and gets implanted in the wall of the uterus anywhere, wherever it gets the chance. Now the implanted here, and this canal is going outward. This is called cervix, and below the cervix is this vagina. So sperms come from here, they travel up the vagina, pass through the cervix, and then travel the uterus to reach the fallopian tube, where they meet the egg and they combine to form what is called fertilized egg. That is the you can say the start of the life in the uterine body. It will be implanted here, placenta will be formed. When delivery occurs, it will get detached from here, from this wall, and it will come out through these things. Don't be get surprised. This is a very small opening. We call it a potential space, means very small space, but during pregnancy this can enlarge to become a big space so that baby can come out. Now does smoking affect the sexual organs? The answer is simple: yes, it does affect, But which organs smoking affects? That also is important. That it affects practically every organ of the body. It can affect heart, you all know it, heart disease, ischemic heart disease, and many other things. It can affect lungs, causing chronic lung disease, chronic bronchitis, emphysema. It can affect the bones. Last time I had told you people what bones. It affects the urinary system, kidneys, some kidney tumors like renal cell carcinoma are more common in the smokers. Then it can affect the other functions. For example, some people cannot hold the urine, they have to rush for passing urine every now and then. This is called overactive bladder, and overactive bladder is more common in smokers. So friends, this I told you last time, and then today I am telling you about this thing, that what it can do to the urinary system. Now we have certain questions which we will slowly answer one by one. Most importantly is the prevention of erectile disorder. And the question would be, if a person is a smoker and he stops smoking, would his erectile function improve? Yes, it will improve. How long it will take? It will take about 2 to 12 weeks time to become normal. Is smoking bad for sperm? Well, it has been seen that in smokers, the semen volume becomes low, the sperm count becomes less, there are few normal sperms, and the motility is also less in those who are smoker. What about erectile dysfunction? The erection is possible only when there is a blood supply to the organ increases. Smoking normally disrupts the wall of the blood vessels, and therefore in smokers this area does not get sufficient blood supply, therefore they do not get erection, and that is why the cause of erectile dysfunction. And other relevant thing is, does smoking increase does testosterone levels increase in smokers? Yes, smoking can increase the testosterone levels, both free and bound testosterone increase. Then, does smoking affect the sperm? Yes, I have already told you about this thing, that it can affect the sperms. And does sperm recover after quitting? Yes, again they do recover after one stops smoking. Men who quit smoking, but there is some time limit, that it is 3 months. Those who quit smoking 3 months before they plan pregnancy, they can have normal sperms capable of fertilizing an egg and creating a healthy baby. How can I increase my sperm speed? Well, this is a simple thing. Maintain a healthy lifestyle, take a healthy diet, take regular exercise, prevent sexually transmitted diseases and other infections, and manage stress. These are the important things. If you adopt, you can have healthy sperms. Do older men last longer in bed? Yes, this also has been observed, that older men though get erections less often, but when they last longer as compared to the younger people. Now our next question is, does smoking affect the uterine line? What is the effect on the uterus? Smoking cigarettes can cause cervical cancer. Remember, this is a very important thing. Smoking cigarettes is the highest risk factor for cancer of the cervix in the female. But few years after smoking, the risk becomes almost negligible. And another important thing is the lining membrane of uterus is called endometrium, that becomes thin significantly. Does smoking affect your vagina? Yes. Again, it can affect the vaginal as well as urinary infections are more common in smokers, and vaginosis is another condition where which is more common in the smokers. Sometimes the people complain of that my uterus hurts after smoking. We know that smoking can cause vasoconstriction, and when this vasoconstriction occurs in the uterine wall, it can hurt the patient. Then, can smoking hurt your ovaries? Well, it has been found to disrupt normal ovarian function. Normal ovarian function can be addressed. The number of mature eggs in the ovary may decrease, and the concentration of female hormones becomes less. Can smoking cause ovarian cysts? Smoking has been considered as one of the important risk factors for developing ovarian cysts. And what happens in PCOS? It is called polycystic ovarian syndrome. Polycystic ovarian syndrome. It has no treatment, and smoking makes it worse. Remember this important point, that smoking makes it worse. Does smoking also affect the fallopian tubes? As I said in the beginning, that it affects practically every organ. It affects even fallopian tubes. It can reduce their motility and therefore difficulty in movement of the ovum. Now, how does it affect ovaries? It can affect ovaries due to hormones as well as due to direct effects. The healthy ovum become less in the ovaries. And what if the husband smokes? Well, even that can affect the female. The pregnancy may become delayed, or may be difficult to, the woman may be difficult to conceive. This is because of the effect of passive smoking. All types of parent smoking is bad for the baby. Remember it, that there are increased incidence of congenital heart diseases in those who smoke or who are exposed to the tobacco smoke, whether it is the father or the mother. And it has been found that 75% of men smoking, 4% for passive smoking in women, and 25% for women smoking. This effect can occur congenital heart disease. So friends, you have seen that the smoking can affect our kidneys, it can affect the lungs, it can affect the renal system, it can affect the sexual organs, and more organs also, which we will be talking next time. Thank you very much, friends. We will meet next time with a new